What is the best way to handle anxiety?
Anxiety, as is depression, is mental illness that is most effectively treated, okay? Well, as I said before, with therapy or with medication. With anxiety, in particular, one of the most popular methods is something that's called cognitive behavioral therapy, okay? And what cognitive behavioral therapy does is it really targets the, I guess in terms of anxiety, the anxious thoughts that are, I guess, propelling a person to be more and more anxious. For instance, a person may be anxious about the fact, oh, I'm not going to do well on this test. I'm not as pretty as everybody else. What happens if I walk into the street and I'm going to get hit? So what cognitive behavioral therapy does is it targets those thoughts. It will ask a person, for instance, to say, what is the thought that's causing you the most anxiety? Okay? And what we would do is we would look at how rational or how irrational that thought is. Okay? And once we've established that it's irrational, it is not likely to happen, because whenever the person starts to have these anxious thoughts, we would have them go back to the fact that this is irrational, it's not very likely that it's going to happen, so on and so forth. So, again, it's really a combination of cognitive behavioral therapy as well as medication, which treats anxiety most effectively.
Okay, so when people can't really have access to therapy, what can we do now, we're suffering from anxiety now in schools? What are some methods that we could use for that?
Okay. Well, certainly you could, first of all, I would say you should just talk to your parents about it, okay? And mental health services are pretty widely available, even though within, I guess I'll say lower income minority communities, there is a great disparity in terms of the availability. But if in fact you're not able to afford or have access to mental health services for anxiety and depression, what you could do yourself is to try and relax, okay, try and meditate, try and challenge those thoughts that I just talked about. How likely is it that this is going to happen? Let me substitute a negative thought for a positive thought. Let me focus on the present, okay? Let me focus on where I am. I'm in this room now. How does it feel in this room? While you're focusing on something other than anxiety, you're breathing in, you're breathing out, and those symptoms, those thoughts that are really propelling the anxiety are getting pushed away. Another thing I've done is to have patients or clients visualize anxiety like a wave, for instance. It's going to start just maybe low, I'm starting to feel a little anxious, I'm starting to feel a little nervous, and then it's going to peak. But then once it peaks, it's going to go down. It's going to start to remit and go slower and slower. So, certainly give yourself time, try to use those techniques in terms of breathing in, breathing out, meditating, not paying attention to the thoughts that are making you anxious and saying it's going to pass, it's going to pass. So those are just some tips.
Thank you. So branching on anxiety, when does anxiety start to become a health issue?
Well, what I would say is that if it continues and it becomes more and more intense, sometimes people have what we call panic attacks. And when you have a panic attack, you really feel as though you're having a heart attack. Your breathing gets very, very fast. Your chest starts to hurt, and you're just really nervous like that. So much to the point where people go to the emergency room really thinking that they're dying and they're having a heart attack. So again, if you have anxiety that's untreated and it continues to escalate, it can certainly have those kinds of physiological